Medication errors are one of the major safety challenges for hospitals around the world. And it's estimated that in Australia, medication errors cost around $1.3 billion each year. Most hospitals in Australia are starting to roll out or have already implemented these systems in their hospitals as a major strategy to improve medication safety.
How are you going? Good. Got some pain relief here for you.
Instead of clinicians having to handwrite medication orders on a paper medication chart, we now have computer systems whereby they enter the information, and the power of computers is that we can actually provide them with guidance as they're undertaking the process. So we can potentially alert them to errors before they happen. Some of our research demonstrated that in adult teaching hospitals we found a 50% reduction in prescribing errors following the implementation of these systems. And more recently now we've been looking at the effectiveness of these systems in paediatric hospitals. So we've undertaken the first study of its type in Australia and one of the few internationally which have looked at what happens when you implement these systems and how effective are they at actually reducing medication errors when they're implemented in children's hospitals.
Good job. Thank you, buddy. You're good?
12 months after the introduction of these systems, we saw a 20% reduction in prescribing errors in the hospital. And most importantly, we looked at those prescribing errors which have the greatest potential to cause harm to children. And we also saw a 20% reduction in those types of errors. The more that we can reduce medication errors, not only are we preventing harm and making it safer for children, we're actually saving the health system money and saving families money. So this research still has some way to go. So we'd really like to learn more about how we can design these systems better, how they can actually integrate better into doctors and nurses' work practices so that they can become safer and more effective. But also to take account of the fact that medicines are becoming more sophisticated. We're now talking about genomics and tailoring medicines, what's called precision medicine. And so we need to have systems which allow us to ensure that that new evidence which is being generated by our great scientific researchers is able to be translated into everyday clinical decision.